What is a CBC? Have you ever gone to hospital and the doctor asks you for a CBC, a complete blood count, or a full blood count? Well, today I'm going to give you 3 reasons why doctors usually do that. Hello, my dears. My name is Davis. I'm a clinical officer with over 10 years experience in medicine. So I want to share with you my insights on what a CBC is and its functions. Now, these are not limited to only these three. Doctors use this CBC for a various range of diagnoses, but predominantly they're based around these three. So what is a CBC? A CBC is a complete blood count. It means that it counts various components in your blood. Now, these include white blood cells, red blood cells, and platelets, amongst others. The other good thing with the CBC, it looks at the sizes of various cells, especially the red blood cells, and can help you diagnose what type of anemia a person has. Now, a CBC is basically a map. It tells us these three things. One, it tells us the type of infection you have. It can tell us if you have a bacterial infection. It can tell us if you have a viral infection. It can tell us if you're stressed. It can tell us if you have worms. It can tell us if you have anemia. Basically, it can tell us a whole lot about you based on your blood. Now, usually doctors first examine you and they have a working diagnosis. But a CBC usually is just a confirmatory, or it helps the doctor or the clinician really narrow down what the issue is. Secondly, it's used to see how treatment is working. Yeah. For example, if you have cancer and I give you chemotherapy or any other medication, I can be able to tell if the medicine I gave you actually crushed your system, crushed your immunity, and how to bring it back up. Or if I diagnose you and you have anemia, I can easily, I give you medication. Then the next time you come back, let's say after a month, I test you again and I see how you're progressing, if you're actually recovering. The third purpose of a CBC is for wellness checks. We use it as doctors and clinicians, usually in annual body checkups. Yeah. Every year when you go to the doctor and say, for your annual checkup, the doctor will always ask for a CBC to see how you're doing. Since your family doctor is seeing you over and over again, as they look at your CBC and how you're progressing in life, they can tell that something is off or something needs correction, especially when it comes to diseases like cancer and all that, especially the disease of the blood and the bone marrow. The doctor can actually tell, oh, I think you're going in the wrong direction. Let us do further tests. Let me have a referral. Let me talk to an oncologist or go and do these other tests to see what's going on in your life. You get it? Are you stressed? Are you doing well? You know? Yeah. So those are the three predominant uses of a CBC.